I'm washing my hands, I'm walking in the room. Hi, my name is Jacob.
Hi.
I'll be your student nurse practitioner doing your wellness exam today. Can you tell me your name and date of birth?
Ryan Goodner, July 25th, 1991.
Can you tell me where you're at?
The clinic,
What year is it?
2025,
And why are you here?
for a wellness exam.
Patient is alert, awake, and oriented to person, time, place, and situation. So we're going to start your wellness exam with your head and neck. First, I am examining your head. It appears normal, cephalic, no obvious signs of trauma. I'm going to go ahead and palpate your head. Any pain or tenderness?
No.
No pain or tenderness. The anterior and posterior fontanelles are closed as expected. Head feels symmetric. Next, we are going to chest cranial nerve 7, your facial nerve. Can you raise your eyebrows? Lower them. You can scrunch your eyes. And can you smile? Cranial nerve 7, the facial nerve is intact. Next, we're going to test cranial nerve 5, the trigeminal nerve. I'm going to touch your face with a cotton ball on each side. Say yes if it feels equal on both sides.
Yes. 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 Thank you. It was equal both sides.
Thank you. Next, I'm going to palpate your. Can you clench your jaw, please? And then open and close your mouth. Clench your jaw one more time. So, feeling his masseter and temporalis muscle, and feeling him clench his jaw, his trigeminal nerve, both motor and sensory, for cranial nerve 5 are intact. Was there any pain or tenderness when you were opening or closing your jaw?
No.
The temporal mandibular joint is non-tender, non-painful. I didn't feel any clicking or popping, and it moved evenly when he opened and closed his mouth. Next, let's take a look at your lymph nodes. Can you tilt your head forward, please? I'm palpating the occipital lymph nodes and the posterior auricular lymph nodes. You can lift your head up. Post-auricular, I don't know what I said. Pre-auricular lymph nodes, the tonsillar lymph nodes, the submandibular lymph nodes, the submental lymph nodes, the anterior cervical chain, both superficial and deep, the posterior cervical chain. Can you shrug your shoulders forward? The supraclavicular lymph nodes, the infraclavicular lymph nodes. Can you lift your arms slightly? The axillary lymph nodes, and I'm going to feel inside your elbows for the epitrochlear lymph nodes. Was there any pain or tenderness?
No.
All lymph nodes are palpable, non-tender, soft, mobile, and they are equal bilaterally. Next, we're going to take a look at your thyroid. Could you lift your head, please? No obvious masses or goiters present. I'm going to have you to put a sip of water in your mouth. I'm going to get behind you, place my hands on your neck, and then swallow when I tell you to. As you tilt your head forward, swallow. The thyroid moved up and down. I did not feel any nodes. The thyroid felt symmetric. I'm going to have you take a sip of water again. Any issue swallowing?
No.
Can you count to 10?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
No signs of coughing or dysphagia. Voice is clear and normal. Cranial nerve 10, the vagus nerve is intact. Let's move on to the eye exam. I'm going to give you this chart. I want you to hold it at about an arm's length. I want you to close one eye and read the smallest line you can.
4, 2, 8, 7, 3, 9.
Can you do it with the other side?
4, 2, 8, 7, 3, 9.
Can you do it with both eyes now?
4, 2, 8, 7, 3, 9.
Using the Snellen chart, his visual acuity is 20/20. Do you use corrective lenses?
No.
And that is without corrective lenses. Next, we are going to do a pupillary light reflex test. I'm going to have you just stare towards me. I'm going to shine a bright light in your pupils. Normally, I would dim the lights, but we can't in this room. So I'm going to look at the pupil and shine the light in first. Now I'm going to look at the opposite eye. It is both direct and consensual pupil constriction with a light. So the afferent limb of the ocular optic motor nerve 2 is intact, and the efferent limb ocular motor nerve 3 is intact. Next, I'm going to have you stare at the wall straight ahead of you. I'm going to bring the pen light close to your face. I want you to look at the pen light when it gets close to your face. Looking at the wall, his eyes were slightly dilated in distance. As I brought the pen light in, his pupils constricted and his eyes converged. Ocular motor nerve 3 is intact. Next, I'm going to check your confrontational fields. I want you to cover your right eye. I'm going to cover my left eye. I'm going to put my fingers towards you. I want you to keep looking straight. Tell me when you can see my fingers in the periphery.
No. 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 No.
Now cover your other eye and we'll do the same.
No. 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 No.
Confrontational fields are intact with his peripheral vision for optic motor nerve 2. Next we are going to take an external look at his eyes. His eyelashes look good. His eyelids appear normal and symmetric. Conjunctiva is pink. His sclera is white. His corneas are clear. Irises are even. Pupils are equal and round. There's no drainage, no swelling, no signs of trauma. Next we'll take a look at your ears. Externally, there's no obvious signs of trauma. They appear symmetric. You're going to palpate with your pinnas, your tragus, your mastoid processes. Any pain or tenderness? Okay. No pain or tenderness when palpating the external ears. Next I'm going to take a look at the white. Let's look at your external ear canal. I don't see any obvious foreign bodies, drainage, swelling or redness. Bilaterally. Next I'm going to take a look inside of your ears. I'm going to anchor with the hand I'm holding the scope in, pull the pinna up and back. The tympanic membranes are non-bulging or retracting. They are pearly gray. I can see the incus and the malleus. The cone of light was 5 o'clock on the right side and it's 7 o'clock on the left side. Again, there was no cerumen, foreign bodies, or redness or swelling within the ear canals leading up to the tympanic membrane. Next, we'll do a whisper test. I'm going to step behind you. I'm going to have you close your left ear and I'm going to whisper something to you and I want you to repeat it back to me.
1, 2, 3.
And on the other side, now cover that. Switch.
6, 5, 4.
Gross hearing is intact. Vestibular, cochlear, cranial nerve 8 is intact. Next we are going to move to the nose. Looking at his nose now, it appears symmetrical. There's no obvious signs of trauma. I'm going to palpate your frontal sinus, your maxillary sinus, the bridge of your nose, any soft tissues, any pain or tenderness. Perfect. It's non-tender and non-painful in his maxillary and frontal sinuses, as well as his nose bridge and soft tissues. Next, I'm going to have you tilt your head back. I'm going to take a look inside of your nose. Going to pull the tip of your nose up. Take a look in. Looking at the inferior and middle turbinates. Excuse me. There are no obvious deformities. I don't see any nasal polyps. The septum is non-deviated in midline. There's no erythema or swelling or redness indicating allergic rhinitis or infections. I don't see any drainage present. Next, we are going to have you occlude one nostril at a time, and I want you to inhale in your other nostril. Nares are patent. Next, we'll move on to a smell test. I'm going to have you close your eyes. I'm going to place something scented. I want you to occlude one of your nostrils. And you're going to inhale when I tell you to. Inhale.
Coffee.
And we're going to do that again. Now occlude the other side with your eyes still closed.
Alcohol.
Perfect. Olfactory cranial nerve 1 is intact. He's able to differentiate smells. Let's go back to visual. I'm going to do an H test to test your extraocular motor movements. I want you to keep your head straight towards me and only move your eyes following my pin light. Extraocular movements are intact. Cranial nerves 4, the trochlear, cranial nerve 3, ocular motor, and cranial nerve 6, the abducens nerves are all intact. Next, let's take a look at your mouth. Can you open and close your mouth? Lips move symmetrically. The lips are pink and moist. He's able to close his mouth entirely. I'd like you to open your mouth. I'm going to take a look inside the front of your mouth. Dentition is intact. The gingiva is pink and moist. The buccal and subglossal mucous membranes are pink and moist and intact. No erythema. I don't see any drainage or swelling. Can you stick your tongue out, move it side to side? Hypoglossal nerve, cranial nerve 12 is intact. And can you stick your tongue out and say ah? The uvula raises midline when he says ah, indicating that vagus nerve 10 and hypoglossal nerve 9 are intact. I was also looking at the posterior pharynx, the retromolar trigon, the pillars, the tonsillar pillars, and the tonsils. I did not notice any erythema, any drainage, any exudate, any swelling. Appeared symmetrical on both sides. Next, we will go ahead and move to respiratory. So I'm just observing him breathe. His rhythm's even, not using any accessory muscles. He's breathing normally. I see bilateral chest rise. Can you lift your arms and continue to breathe for me? The AP diameter is 1 to 2. Not notice any extra respiratory effort. First, I'm going to palpate your chest. I'm feeling for any subcutaneous or crepitus along his sternum, along his clavicles, moving my hands in circular motion, and on the base of his neck. I don't feel any crepitus or bubbly feelings. Next, I'm going to go to behind you. I'm going to place the sides of my hands along your back. I want you to say blue moons when you feel my hands.
Blue moon, blue moon, blue moon, blue moon.
So I can feel some rotation resonance as I should. It's not half resonant, it's even on both sides. Next, I am going to take a listen to your lungs. I just want you to take a deep breath. Each time I place my stethoscope on your chest, if you get short of breath, let me know and we can take a break. Lift your arms, please. And we'll do that to your back as well. Breath sounds are clear and equal bilaterally in all lung fields. I don't hear any wheezing, crackles, or bronchi. I'm going to percuss your chest next. Can you lift your arms, please? And we'll do this to your chest as well. No hyperresonance is heard when percussing the chest. It felt even in all lung fields. We will go ahead and move to cardiovascular now. Normally I'd have him lay supine for this, but for the video we'll stay sitting up. I don't see any heaves or lifts. I'm going to palpate his chest at the left side of his sternum on the second intercostal space. I don't feel any heaves or thrills. I'm going to go down to the fifth intercostal space midclavicular at the point of maximum impulse, and I can feel it. Next, I'm going to take a listen with the diaphragm, my stethoscope, to his heart sounds. On the right side of the sternum at the second intercostal space, listening for the aortic valve. At the left side of the sternum, second intercostal space, the pulmonic valve. Left side of the sternum, third intercostal space, Erb's point. Fourth intercostal space, left sternal border, the tricuspid valve. And fifth intercostal space, midclavicular line, the mitral valve. We're going to repeat those with the bell of the stethoscope now. Next, I'm going to listen for aortic stenosis. I'm going to have you lean forward. I'm going to go to the right sternal border, that second intercostal space. I want you to take a deep breath, exhale, then hold it. No systolic murmur was heard, so I do not suspect aortic stenosis. Now I'm going to have you lay on your left side. Using the bell of my stethoscope, I'm going to go to the fifth intercostal space mid-clavicular line for the mitral valve. I'm going to have you take a deep breath, exhale, and hold it. There's no mid-diastolic murmur. I don't suspect a mitral valve stenosis. Next, we'll move on to vascular. He's got even hair distribution, skin temperature is warm, skin appears appropriate for ethnicity. I'll let you stick your fingers out. I'm going to check for capillary refill. It's equal bilaterally, and it is less than 2 seconds. I'm going to go ahead and have you sit back in the chair at about 30 degrees. And then I want you to turn your head to the left. I don't see any jugular venous distension. That would indicate increased jugular venous pressure. You can sit back up. I'm going to palpate your carotid arteries one at a time. And I'm going to take a listen to them. I don't feel any thrills. Carotid arteries are brisk, +2. I'm going to feel the rest of your arteries now. First your radial, your brachial, and across your legs please, your popliteal, your posterior tibial, your dorsalis pedis. All pulses are +2 and equal bilaterally. I'm going to palpate your calves and shins for edema, as well as your ankles and the dorsum of your feet. I don't appreciate any edema. There are no varicosities present or any abnormal venous distribution patterns. There's even among the lower extremities as well. Now I've got some extra time. I'm going to think if I missed anything. Hair distribution on top of your head's even. Let's check one more respiratory test. I'm going to put my hands on the back of your chest. At about the 10th rib, I'll place my thumbs midline. Can you take a deep inhalation, then exhale? My thumbs pulled apart about 2 centimeters and then came back, indicating equal spread of the ribs as you took a deep inhale. Anything else? Don't say anything. Respiratory. Yeah, feels good enough to me. Okay. I'm done.